Licensure overview. So we're coming up to the big announcement of what is new this year. Executive Director Nixon's going to tell us about it. But again, when we decide on who gets licensed and who gets renewed, we're looking at three main buckets, right? I like to think of things in like three parts. So education, do they go to an accredited school? Did they graduate in good standing? Did they fulfill all the requirements of their school, their medical school, or their residency if they're seeking full licensure? If they're foreign trained, is trained outside of the U.S., have they fulfilled, all of the requirements? If they're coming under the eminence license, what is their training? What is their qualifications to serve in the capacity that they're serving? So that's why you have to get, licensure scores from the United States Medical Licensing Examination. I always remind people USMLE is not a test to get into residency. The L stands for licensure. So that's why you take the USMLE to become licensed in the US, and et cetera, regarding your education. Examination, so we have that there, USMLE or COMLEX if they're an MD or a DO. Again, L is for licensure. And finally, experience. Have they obtained the necessary clinical experience to competently practice via ACGME standards? AOA accredited postgraduate training is the standard that we use. Next. And this is my final slide, and then I'm going to turn it over to Executive Director Nixon. Some of the components that are specific to DC. Now, remember, I said 70 boards, and a lot have different standards, which I'm sure some of you who have various licensure or are licensed in various jurisdictions know. But here in DC, we look at responses to screening questions and the Clean Hands Act. So, have you answered any of the questions in the affirmative? And do you owe any fees to the District of Columbia? Again, we're an umbrella board. And so, they are looking at, I think it's if you owe over $100 in terms of like tickets or outstanding fees, taxes, et cetera, we, like every other board, DC follows this Clean Hands legislation. Criminal background check. So do you have a competent, have you completed the background check, and has it been approved by our legal department? Vaccinations. So this is attorney, executive director. I'm making you all kinds of professions. You're a doctor, you're an attorney. Executive Director Nixon is going to tell us a little bit more about that. Currently, per the law in DC, per the current instructions, you do have to have proof of being fully vaccinated for COVID-19 or have a department approved exemption. But she's going to tell you further information about that, the current status of that. Additional licenses. So if you have additional licenses, have you provided proof that those other licenses are in good standings from other jurisdictions? If you have a license that's under review or in question from another jurisdiction or another state, that could hamper the renewal process of your DC license. So that is something that we do look at. Jurisprudence examination. Some of the boards, not the Board of Medicine, but some of the boards do ask for a jurisprudence exam. And finally, everybody's favorite, the PDMP. Have you applied and are you registered with the Prescription Drug Monitoring Program? I believe that is my last slide, if I'm correct. And thank you for that time. And I know the main show, I felt like I was like the opening act. I was like the new band in town, but like the main stage is about to happen. And Executive Director Nixon is going to give you ideas of what is new this year and what you need to renew your license. Thank you so much for your attention. And I'm going to turn it over to her.
Thank you, Dr. Anderson, and thank you, MSDC, for allowing us to be here today. Just talking about the 2022 renewal process for the DC Board of Medicine. What's new? So our renewals are biannually, so it occurs every year. All professions under the Board of Medicine renew at the same time, and also have the same expiration date. So all licenses issued under the Board of Medicine expire on December 31st of the even year. The process is exclusively online. Some changes that are occurring this year are new continuing education requirements, specifically the public health priorities. These are Department of Health identified public health issues for continuing education. Physicians will be required to do, all licensees are required to do 10% of the required continuing education. So for example, for MDs and DOs, you have a requirement of 50 continuing education units that are required for your renewal. So 5 continuing education units must be done within the identified public health priorities. It's a very vast list. It includes things such as ethics, things related to vaccines, things that you probably have already taken or take. That was one of the considerations when reviewing and determining what these public health issues would be. So the director did take into consideration that, looking at what everybody is required to do and kind of seeing so that individuals are not, leaning too far out of their scope of their practice. So you would be able to find the link. It's on the board's webpage, and it identifies the 10 areas in which you can select from in order to do the 5 continuing education units that would be required. For physician assistants, that would be 10. The other requirement is the LGBTQ cultural competency. That's 2 continuing education units that's required. So of your 50, that's 7 that you would need to do, that's separate, and then to include the one from pharmacology. So that's 8. So 42 would be in your, maybe your specialties, something related around medicine, and then the other 8 are specifically assigned based on legislation or DC health policy. The HIV continuing education is no longer required. That was sunset, I think, about 2 renewals ago. So individuals are not required to complete the HIV continuing education. If you do the HIV continuing education, it, I believe, may fall into one of the accepted categories for the public health priorities. All licensees who can prescribe must register for the prescription drug monitoring program, or their license will not be renewed. That is a requirement. So all physicians and all physician assistants have the ability to prescribe, even if you do not hold a controlled substance registration. You are required to register with the prescription drug monitoring program per the legislation. Some of the enhancements is that we do have a paid and active option, which has always been there, but it's actually separate. I know in the past, a lot of individuals may have gotten confused, and then they may have selected paid and active, but didn't want to select paid and active, or they wanted to select paid and active, but missed it by chance and didn't get the opportunity to. So when you get onto the landing page about selecting your application for renewal, they actually have a paid and active application that you can select. The other thing is the workforce survey. The enhancements to this year's workforce survey is that there's skip logic that's been added to the survey in partnership with another administration here at DC Health, the Community Health Administration. There's been some additional updates to the workforce survey to include the mini Z, which kind of focuses on provider burnout and wellness. And so you'll be able to provide feedback about that. Again, and then just the major components to licensure, it goes back to almost exactly the same components that are required for initial licensure. The things that are different, again, are the continue education, your workforce survey, and then the prescription drug monitoring registration. So again, just making sure that you update your demographic information so that the board has the best contact information for you. Your screening questions, your clean hands, the continue education requirements, the workforce survey, the criminal background check. With the criminal background check, that is required every renewal. That is not that you have to go in and do updated fingerprints. However, it will be done. It's a national name search that's done. Then the vaccination attestation. Again, currently, individuals are required to be fully vaccinated meaning that they've received either the 1 dose of the Johnson's & Johnson's or both of the doses for Pfizer or Moderna, or they have a DC Health exemption, and that's the current requirements. And again, the prescription drug monitoring registration, and then paying the fees. I'm gonna stop sharing for the moment because I'm going to do an actual live demonstration of the test site for the Renewal portal. All right, so this would be the landing site for individuals who are renewing. When you click the link for first-time renewals, there is a different page. You would have to register. Once you register, you would receive an email with your credentialing, and it will then send you to this site. Once you get to this page, for individuals who already have an existing email address with us and password, you would come to this page and log in. Once you get to this page, it will let you know all the licenses that you have that you can select for renewal. So we know that there are providers that have different and multiple license types that might be up for renewal. All those licenses that are up for renewals will show right here. This is exactly what I was talking about. You do have the ability to select the paid and active application. You would hit apply. If you are not doing paid and active and you're going to go into renewing your license, you would hit the renew button. Once it gets here, again, it'll demonstrate and show all the different licenses. You're going to start with your medicine license. You're going to select and then save and continue. Here, for individuals who are existing, and this is not a first-time renewal, our system will port your information over. So in essence, you are just here to kind of verify that this information is correct. And then you would make any necessary changes. For individuals who have recently had a legal name change, you would put that you've had a name change. The documents that are required are a copy of your marriage certificate if you were recently married, if you were recently divorced, a copy of your divorce decree, and if you just wanted to change your name, a copy of the court documents. If you answer that you've been married, it'll ask for you to indicate any of the name changes, and then you would upload the document. Here is when you get to the vaccination portion. It's going to ask if you are vaccinated. So I've indicated I'm fully vaccinated. It'll ask the dates, and then it'll allow you to, it'll ask you if you've received the booster. If you have not, you can say no, and it will allow you, then you will hit save and continue. Again, the next page is the applicant address information. Again, if you indicate your preferred address is your home address, you would put that here, and then put your home address. The key next answer is Do you have a business address? For those who hold a controlled substance registration, just as an FYI, in order to renew your controlled substance registration, you have to have a DC business address. Okay, so for me, for my purposes, I selected that I do not have a business address. It will ask a reason, and I just stated that I practice in Virginia. If I had stated yes, the business address would pop up. Again, PO boxes are not acceptable. You need to have a physical street address. The next section is the screening questions. There are 10 screening questions. You would answer these questions. Any questions that are answered in the affirmative, you must add a description and upload any of the supporting documents. So for example, if you answer screening question number 2, if you've had a malpractice since your last renewal, you would then click this form. It's going to take you to this link, and then you can upload the malpractice form. So you would complete that and add it to your application. Right. So if you answered yes, you're going to put a description and upload the file. Just please be advised that any questions that are answered in the affirmative will delay your renewal. That means that your application will be placed on hold, and then the board has to review the matter. So it could be that it's something that's simple that the board has delegated to the board staff, and we have the ability to remove the hold, or it could be something that it's a little bit more serious and it has to go to the full board to meet. The Board of Medicine meets monthly. We meet the last Wednesday of every month. And so that's when the application, your renewal application, will be placed on the board's agenda for review. The next section is the continue education. So there are 3 options when responding to the continue education question. Again, you will note that if you are a first-time renewal, so if you received your license and this is the first time you are renewing, you are exempt from the continue education requirements. So no uploads are needed. If you have that you've completed your continue education, you must upload the supporting documents. So that would be a copy of your CE transcripts, a copy of the certificate so that it could be reviewed. We do ask that when you upload, if you're uploading your continue education, you upload it as one file. So again, instead of individually, it takes a lot to kind of count 50 and review 50 different sheets. It's easier for staff to download one PDF. So I'm going to select that I will complete my my continue education. If you select you will, again, you may decide that you want to do your renewal on October 15th. You still have until December 31st to complete your continue education. So your option, you do have the option to select, I will complete my CEs by December 31st, 2022. Another section is that we usually ask if you have a specialty. If you say no, nothing will happen. If you say yes, it kind of will put what that practice specialty is, what your certifying board is, and if you have any additional specialties. Then it's the prescription drug monitoring program. Again, you have to indicate if you are registered. If you select that you are not, it will provide you with the link so that you can complete the registration. As stated, for MDs, DOs, and PAs, you have to register with the prescription drug monitoring program as required by legislation. If you are not registered, your license will not be renewed. Then we're going to get to the workforce survey. I'm going to skip through this. The workforce survey is definitely a crucial survey in the sense that we utilize this to determine the workforce in the District of Columbia. You know, a lot of the big news currently is the workforce shortage. The mayor has a whole task force regarding workforce retention and recruitment. And also some of our other agencies kind of utilize the information garnered from the workforce survey, such as healthcare finance when determining reimbursements. Our community health administration, one of the administrations here within DC Health, utilizes the workforce survey feedback to help regarding the healthcare providers loan repayment program, and that helps us to get more funding so that individuals can get their loans repaid, because we know that going to medical school, going to become a PA, it's not an inexpensive venture. So you would answer all of these questions and then move forward in the renewal. And again, this renewal will have skip logic. So if you've answered a question and you say no, it will skip to three questions ahead if that's the order. And again, it will also include the mini Z, which is focused on burnout and wellness. And then we come to the clean hands. Again, as Dr. Anderson indicated there, this is one of the other things that there are 3 reasons why, for the most part, an individual cannot be renewed. 1, if they do not complete the continuing education, because that is a requirement of the regulations for your renewal. 2, if you are not registered with the prescription drug monitoring program. 3, if you owe the District of Columbia any money over $100. And that's the current Clean Hands legislation. I think they're making updates to that, but as of today, this is where it stands. If you do owe, what we ask again, when we talk about taxes, specifically DC, District of Columbia taxes, not if you owe federal taxes, that does not have to be disclosed. If you do owe the District of Columbia any monies related to like a traffic ticket, if you demonstrate that you either have a payment plan, if the matter is being adjudicated, or you have a copy of your receipt, then the hold can be removed. And then of course, I did forget, we actually therefore the vaccination requirement as of today. Again, with the criminal background check, you are just consenting that you will allow the District of Columbia Department of Health to perform a criminal background check. This will be done based on a name search. You will not have to go and get your fingerprints rescanned. And then we get to the last point, which is just talking about the payment. So again, for physicians to renew, it is $550. $500 is the renewal fee. $50 is the CBC fee. All right, give me one more second. I'm gonna stop sharing and take it back to the PowerPoint.
Aisha,
Please continue to add any questions into.
Yeah, we got a lot of questions about the CBC during
I
the
can't hear.
renewal. You can't hear me too well? Can you hear
No.
me now? Uh-oh.
I can hear you. You were saying.
Okay. Yeah, there's a lot of questions about how to complete the CBC during the renewal process. If you could just clarify that, how they actually do that through the online portal.
Sure. So with the renewal process, again, when you give your consent, you physically do not have to do anything, unlike your initial licensure where you received the code, you had to schedule and then go someplace and actually complete your scanning. With renewals, all you do is give your consent and agree to allowing the District of Columbia the ability to run your criminal background check. We will then do a name search. There's nothing required by you except giving your consent. All right. So I just wanted to kind of just show the fees for all of the other professions that fall under the Board of Medicine. Again, for physician assistants, it's $145. That is not inclusive of the $50 for the criminal background check. And then the specific continuing education requirements for MDs and DOs, and then PA. So again, that's 50 for the 2-year time frame. So again, the 2-year time frame that the continuing education units must be completed, it's January 1st of 2021 to December 31st of 2022. So the continuing education that will count for the 2022 renewal has to have been completed between January 1st of 2021 to December 31st of 2022. For PAs, you can substitute doing the 100 CEUs if you have your current NCC PA certification. However, you still will have to complete the 2 hours of the LGBTQ cultural competency and the 10 hours related to the public health priorities. This is just a quick overview of the other professions and their continuing education requirements. And then some online resources. So again, DCRX, like the Center for the DC Center for Rational Prescribing is one place that a lot of individuals can get continuing education. They have courses on implicit bias, which is one of the 10 public health priorities. Again, you can probably find your pharmacological course on here, which is just one. One of the other topics on the public health priorities is opioid prescribing. So again, you'll be able to find a number of that. And that is the DC Center for Rational Prescribing. One of the things when you are renewing your license, so you should get your license if there are no issues within 24 business hours of renewing, because we have to ensure that you are registered with the Prescription Drug Monitoring Program. Your license will, once that's vetted, that's done every night, then your license would be sent to you the next day. The District of Columbia no longer sends hard copies. You will get a digital copy of your license that will be sent to you via email. However, if you need to provide verification of your license, what you can do is go to the doh.force.com/BRE/S. That is the verification website for licensure. I know a lot of people, if you've been in the district for some time, have the old HPLA address, and that is inactive. And now we're at the point for if there are any additional questions that have not been already addressed in the chat.
Thanks so much, Ms. Nixon. I mean, there are a lot of questions in the chat. We've been trying to keep up with them, but I think some of them, it would be great if they could be directly answered by members of the staff or yourself, or I can jump in as well. And then there's been several asks for the question list to be distributed to the attendees afterwards. So we'll work with MSDC to see if we can post a list of the questions, or maybe group them into like frequently asked questions or something like that, so we can make sure everyone has the information.
And there is a good question on where is the link, and we can definitely put the link, but just as an FYI, so the renewal period for the Board of Medicine will not open until the first week of October. All licensees will receive notification via their email when the portal is live.
One big bucket of questions was regarding continuing education. And many of the webinar attendees were asking, how do they put their CME certificates into one PDF? Is it sufficient for them to simply list the titles and how many credits they received, or what would be your suggestion? Another ask, could they make it into a zip file? That was another question too. So you
I
want to,
don't know if a zip file can be uploaded. I don't believe so. I believe it has to be like a combined PDF file. My recommendation is that if you would be to maintain your copies of your certificates. At the end of the renewal cycle, all boards are required to do a random audit of their licensees. If you are selected for that audit, you will be instructed on how to submit the continuing education units. Typically, just having a list of the courses you took would not be sufficient. In order for us to determine that you have met the requirements, we would have to review all of the continuing education certificates to show that your name is there, be able to assess how many hours you were granted to ensure that you meet the 50 or the 100. So again, getting copies would be the copies being emailed would be the best if you are audited, and then you'll get instructions on how to submit those. But if you do want to upload them, again, I'm doing a combined PDF file. If not, again, you can individually upload each certificate, but a combined PDF file would be the best thing.
Aisha, could I pop in real quickly?
yes.
Could I pop in real quickly?
Yes.
I hope I know Dr. Anderson can hear me. I hope other people can too. The question about the 10%, somebody asked about 10%. You do not have to tell us, oh, this, right on the paper, this course satisfies this. If we audit your file, we will see what those courses are that you provided and see if they satisfy some category there in the list of public health priorities. If you look at that list, it's quite broad. I think Dr. Nesbitt, who, as most of you know, is a practicing physician herself, really believed that taking 50 CMEs as a practicing physician, you will easily satisfy the 5 credits required in the public health priority, in terms of your professions. But we should be able to figure out from your submissions what satisfies the 10% and where that goes. And to that effect, somebody asked, is just the list enough? You need to show us that you have taken CME category or AMA category 1 CMEs in order to satisfy the CME requirement for those of you who are physicians. So we will be looking for that if your file is audited. So that's what we need. If you can scan all those single pages, you got 0.5 hours in this and 1.5 hours in that, scan them and upload them. And we should be able to tell from that if it satisfies the 10%, as well as the 2 hours LGBTQ, which cannot be part of your 5 required public health priority CME. But we do require all of that. And there's no telling whose file gets picked to audit. It is a random audit.
Right. So that's Suzanne Fensel is our board attorney, and letting us know that she's the omnipotent voice. However, knowing, so there's a question there that says, is it 5 hours? Oh, sorry, 10 hours or 10%. So 10% of what is required for you. So again, as I mentioned, the board licenses lots of different disciplines for physicians and physicians, DOs, surgeons, who are physicians, that we have to have 50 hours. So obviously 10% of that would be the 5. But other groups have different amounts of hours. So you can calculate if you're a PA, you're going to have 10% of what's required for the PA has to fall under the public health priorities. And I placed those earlier in the chat, and those are also available on the DC Health website.
And it's 10% of what is required. So if 50 hours is required, that's 5. If you do more than 50 hours, that's tremendous, but you're only required to have the 5 in the public health priorities. And you should upload them if you can with your renewal application. If there's a problem, we will contact you if we get audited.
So someone asked a question about the paid and active option. So paid and active, it's an option if you select that, means like a lot of individuals who are retiring, who may be relocating, but not sure that they may never return to the district, select the paid and active option. If the paid and active option is selected, however, you are not able to practice in the District of Columbia under a paid and active status, and that includes practicing via telehealth. So paid and active means that you would complete the paid and active application, you pay the required fee. The required fee is typically the same as the renewal fee. If and by chance, when you decide you are returning to the district, so let's say you decide you're going overseas for 2.5 years, and then you come back and your home base is the District of Columbia and you want to reactivate your license, then you would pay the reactivation fee, which is that currently it's $34. I don't think that's going to change. So you pay the bulk of the fee up front. So that's what the paid and active option is. Again, it's usually for individuals who know that they're either retiring, but they may want to decide they're going to volunteer, or again, individuals who are moving but will be returning to the District of Columbia at some point.
There's some more questions regarding CME. The District of Columbia does not charge any money for CME. Sometimes you'll get mailers in the mail, you know, saying, hey, here's a DC Health CME course. Often those are private companies, and if you want to pay for those, you know, that's totally your right, or you know, your discretion to pay for CME, but those are not from DC Health in terms of requesting money for CME. So just to put that out there. Several other people asked about LGBTQ CME. You know, you cannot use last year's renewal CME to count towards this year's renewal CME. The CMEs have to happen within the licensure period, which is January 1st, 2021, right, till December 31st, 2022. So CME that you did in 2020 or in 2019, no, it does not count for this renewal cycle. And as mentioned, we do random audit to make sure, or we meaning the staff does random audit to make sure that the CMEs are falling within the priorities, you know, the public health priorities, the LGBTQ, the pharmacology one. So if you are, that's why she was saying to maintain your copies and all of your certificates. If you are audited, you'll have to present that documentation. And we'll keep this, or we'll work with MSCC to get this information out again, but several webinar attendees listed free sites that can compile your certificates into one PDF. And there's some great links that are in the chat. So we'll make sure we get that out to you. But again, you're going to upload and attest. You're going to say, yes, I did all the things I'm supposed to do. The staff cannot go through and count every single one and get that license turned around to you in 24 hours. However, if you are audited and you said, oh, yes, I did it, and then you don't have that documentation, that's when, you know, there's a discrepancy there. So that's why it's important to attest and still also have that, you know, have the documentation.
There's one question about how long can I continue to renew my license if I am retired. So again, as long as you maintain your continuing education requirements, you can continue to renew your license. So again, that's why the paid and active option is a good option for a lot of the individuals who are retiring and do not intend on practicing, because then when you do reactivate, you do have to meet the continuing education requirements for that previous renewal cycle. So it all depends. But yes, in order to maintain and have the ability to renew your license, is that you do have to keep up with your continuing education requirements.
Okay, so I don't know if you want to, I think we got a good amount of the questions, or are there any, I mean, the staff can also jump in. Are there any major themes that that Ms. Nixon can address that we haven't, or?
So I included the links for the registration for the prescription drug monitoring program. The last link also is the link that identifies the public health issues for continuing education. So you'll be able to have that. I'm going to also put in the chat the link so that you can ensure that you have reported or attested to your vaccination. If you have not done so, because that was a requirement prior to that. I'm also including the link to MODA. If you are interested or know anyone that's interested in joining a board, please feel free to do so. And again, there's a large number of boards, a large number of vacancies. Not only does the Board of Medicine, there are other boards that actually require a physician member to be on their board. It might be a certain specialty, but again, there are other boards, and there are a lot of commissions and task force that the mayor recruits for, this office recruits for the mayor to be able to participate on. So again, for example, the workforce task force, the mayor's workforce on the workforce in the area for retention and recruitment, that is made up of many of your peers in all different professions across the district.
And great for retired physicians too, or physicians that are stepping down on time, but have lots of expertise and experience that they can contribute. We welcome all perspectives. The one thing we will say is that serving on a board requires DC residency. So you need to have a DC address to be on a health board. That does not apply to commissions and task force, but to be a board member, you do have to reside within the district.
And then the last link that I just included is the DC Center for Rational Prescribing. So this is independent continuing education courses that's free to all DC licensed healthcare providers.
There's still a couple more questions regarding clarification on the CME.
So with the CMEs, you have three options. You can select first time renewal exempt. So again, any individuals who just received their license within the last renewal cycle, and this will be their first time renewing, is exempt from the CE requirement. Then you have the option, I have completed my continuing education requirements. If you select that, you are required to upload those documents. Your third option is that I will complete my continuing education by December 31st, 2022. If you select that option, you will be able to move forward. And if you are selected after the renewal cycle is over by our random audit, you will have to provide proof of completion. So there's no attestation that your attestation is if you state that you have completed it, you will have to upload it and provide proof. The same thing, if you select first time renewal, that is also vetted by the staff to ensure that this is the first time you're renewing.
Thank you. I know that can be unclear. And I know everybody on the webinar is really wanting to make sure they complete everything to the best of their ability. So thank you for repeating it, and please feel free to continue to ask questions. And sometimes it takes a few times for the question. We totally get that. So please feel free to keep those questions coming. And we just want to keep letting people know that, if you receive direct marketing about, CEs, about CME companies, those are not from DC Health. You can feel free to take them, no problem. But that's your own choice. DC Health CEs and suggested CEs are going to come from DC Health emails and or be listed on the DC Health website. So just to be clear that those are not representing, not official CEs from DC. I think if we are completed the questions, we can turn it over to MSDC again, representatives, or I think we're finished with our portion. And so we'll allow maybe you all to have your evening back, or we'll turn it over and let you all decide what's next. I'll turn it to Robert Hay.
Sounds good. I'd just like to thank our colleagues at the DC Health for spending time with us today. As a reminder, we've recorded this session and the recording will be made available, and questions will be made available as well. So we'll be coming up with gathering some common questions and doing some FAQs around this. So thank you all for participating. Hope to see you at a future event, and feel free to use both our organizations as a resource.
We'll get those links out too. Several have asked that they want those robust links that were included in the chat. So we'll make sure that we get those all to you.
Absolutely. Thank you, everyone. Have a great evening.
Thank you.